It's becoming increasingly common to see gluten-free food items in your local grocery stores and on restaurants' menus. Our cafeteria here at UNF even has gluten-free options, and a special toaster for gluten-free breads. This is partially because of the increasing awareness and diagnosis of celiac disease. As many as 1 in 141 Americans has celiac disease. The disease is more common in Caucasians and more often diagnosed in females. But because the disease is genetic, you are more likely to develop it if someone in your family has been diagnosed. So what is celiac disease? Celiac disease is an immune system-mediated disorder in which gluten triggers the body's immune system to attack cells of the small intestine. When a person with celiac disease eats food containing gluten, his or her immune system will form antibodies to the gluten. These antibodies will then attack the lining of the small intestine, causing inflammation and damaging villi. Because villi of the small intestine function in nutrient absorption, the person with celiac disease will not properly absorb nutrients and will likely become malnourished. What is gluten? Gluten is a form of protein found in grains, including wheat, rye, barley, and oats. Let's use wheat as an example. Inside a kernel of wheat, there is an endosperm that contains nutrients for the seed's embryo. One of the many nutrients contained in this endosperm is gluten. One peptide component of gluten, named gliadin, is what triggers the immune system's attack in people with celiac disease. So how does gliadin affect people with celiac disease? Normally, when humans eat food that contains gluten, their bodies break down the protein into single amino acids so that its nutrients can be absorbed. In the stomach, gluten protein begins chemical digestion by pepsin enzyme, resulting in short amino acid chains. Gliadin is one of these resulting chains. Usually, protein digestion will be completed in the small intestine, but in those with celiac disease, gliadin will resist being further broken down into its single amino acid components and will enter the small intestine's lamina propria. After a series of changes in the lamina propria, the gliadin will be found by T helper cells. These T helper cells then perform a multitude of actions. First, they release inflammatory cytokines, which will initiate damage-causing inflammation in the villi of the small intestine. Then they will stimulate B cells to produce antibodies against the gliadin. Lastly, the T helper cells will stimulate killer T cells. These killer T cells work to destroy cells undergoing inflammation, specifically those of the villi of the small intestine. The damage and destruction of these cells could allow more gliadin to enter the lamina propria of the small intestine, thereby initiating a positive feedback loop. What are the symptoms of celiac disease? Symptoms vary, but they may include digestive problems such as bloating, gas, diarrhea, and abnormal stool, dermatitis, herpetoformis, a severe skin rash, iron deficiency anemia, a low blood cell count, musculoskeletal problems, including muscle cramps and joint and bone pain, seizures, tingling of the legs caused by nerve damage and low calcium, missed menstrual periods, and lastly, growth problems and failure to thrive in children. There are several health problems that are associated with celiac disease. The first is osteoporosis, a disease that weakens the bones and can lead to fractures. Osteoporosis occurs in patients with celiac disease because the body has difficulty absorbing calcium and vitamin D. Other issues include birth defects, miscarriages, and infertility. These are caused by poor absorption of essential prenatal nutrients, such as folic acid. How is celiac disease diagnosed? If your doctor suspects that you have celiac disease, an in-depth physical examination and a variety of tests will be performed. Blood tests measure the levels of specific antibodies that are commonly found in people with celiac disease. They also measure iron levels in the blood, since iron deficiency anemia is a possible symptom of celiac disease. Stool sample tests are taken to ensure there is a healthy amount of fat in the stool, because celiac disease can interfere with the body's fat absorption. Lastly, biopsy of the small intestine can be taken in order to check for damage to the villi. How is celiac disease treated? Currently, there is no cure for celiac disease. Treatment involves following a strict gluten-free diet in order to manage symptoms and promote intestinal healing. Eliminating gluten will usually improve the symptoms of celiac disease within days and eventually end the symptoms. For most patients, eliminating gluten will allow the villi of their small intestine to heal within 6 months. It is important that people with celiac disease remain on a gluten-free diet, as eating gluten at any point in their lives will trigger the onset of the disease's symptoms. In rare cases, when patients with celiac disease have an extreme amount of damage to their small intestine, a gluten-free diet will not immediately alleviate them of their symptoms. In these cases, the patient must receive nutritional supplements through an IV. Let's review. Celiac disease is an immune system-mediated disorder in which gluten, a protein found in a variety of grains, triggers the body's immune system to attack cells of the small intestine. A peptide component of gluten, named gliadin, is what triggers T helper cells to stimulate other cells and cause damage to the villi of the small intestine. Because the villi function in nutrient absorption, people with celiac disease can become malnourished and experience associated health problems.